Knock, knock. Hi, Mr. K. My name is Nicole. I'm going to be your nurse today.
Hi.
I'm going to be performing a comprehensive health assessment. Is that okay?
Yes, ma'am.
Yes. So I'm going to wash my hands. Normally I would have you verify your name and date of birth, but for privacy purposes, I'm just going to have you give me your initials.
SK.
Okay. I would verify his name and date of birth against his armband to make sure that he is who he says he is. To begin, I'm going to inspect the skin on your arms and your legs, all right?
Yes, ma'am.
Yep, so if you want to sit back and just put out your arms, I'm just checking the skin for integrity, making sure there's no significant issues. The hair is distributed evenly, there's no dryness. Same thing with the legs. No abnormal discoloration. So your arms and your legs look good.
Thank you.
I'm going to assess your nails if that's okay. So I'm just looking for any dryness, any rigidness, clubbing, anything like that. The nails, they're a little dirty, but they're appropriate. There doesn't look like there's anything wrong with them. If it's okay, I want to look at the nails on your feet. Okay. So his feet are a little dry. His toenails are a little dry and they're thick, but they look okay. There's no significant issues that stick out to me. Put your sock back on.
Mm-hmm.
If it's okay, I'm just going to assess your hair. I'm looking for any balding areas. I'm looking for even distribution, stuff like that. The hair is distributed evenly. It's thick. The texture is appropriate for ethnicity and color. He has even distribution on his arms and facial hair throughout. There's no alopecia or signs of any kind of disease that would create some kind of hair loss. So if it's okay, I'm going to move forward and inspect your neck.
Mm-hmm.
So I'm just inspecting for symmetry. I'm looking to see if there's any abnormal masses. The neck is symmetrical. Do you have any pain in your neck?
No.
Any tenderness?
No.
No. Okay. So the next thing that I'm going to do is palpate the temporal arteries, which are up here. So if it's okay, I'm going to put my hands on your face. Temporal arteries are normal, equal bilaterally. Do you ever get any headaches or chronic migraines or anything like that?
No.
No, nothing like that?
Yeah.
Okay. So the next thing I'm going to do is palpate your sinuses. So they're on your face as well. I'm just going to put my hands on your face again. So I'm palpating the sinuses. Any pressure, pain when I do that?
No.
Tenderness?
No.
Okay. So the sinuses look good. The next thing that I'm going to do is palpate your lymph nodes.
Mm-hmm.
All right. So I'm just going to palpate here. Tell me if you have any pain.
No.
Palpating here. Any pain?
No.
Then I'm going to palpate here as well. Any pain?
No.
No. Okay. So the lymph nodes look good. The next thing I'm going to do is palpate your thyroid.
Mm-hmm.
Have you ever had any issues with your thyroid?
No.
No? Okay. So if you don't mind, I'm just going to have you turn to the side.
Mm-hmm.
I'm going to put my hands behind your neck. And I'm just palpating your thyroid. Okay. All right. Doesn't seem like there's any issues there. So while I'm here, I'm also going to have you open and close your mouth. I'm assessing your jaw for TMJ. No pain. There's no cracking when you open and close your mouth. No popping. No. And I don't feel anything beneath my fingers. So the next thing that I'm going to do, if you'd like to sit back for me, that's fine.
Mm-hmm.
I'm going to palpate your carotid arteries.
Mm-hmm.
So just put your head back. Beating on each side. They're normal and bounding. No irregularities noted. Okay, so the next thing that I'm going to do is inspect your ears. So I'm inspecting the ears just on the external area. You know, they look no issues, no presence of significant wax buildup. Do you have any hearing problems? Do you wear hearing aids?
No.
No, okay. So the next thing I'm going to do is called a whisper test.
Mm-hmm.
I'm going to whisper 3 words into your ear while you're covering the opposite ear.
Mhm.
I'm going to ask you to repeat those 3 words back to me, and then we'll do it on the other side. Okay?
Okay. Yep.
All right, so I'll have you cover that ear for me.
1, 2, 3.
Yes, very good. So then I'll have you cover your left ear, and then I'll come over here and I'm going to whisper 3 other words to you.
Cat, dog, horse.
Okay, very good. So the next thing that I'm going to do is inspect the eyes. If you don't mind, I'm going to put my hands on your face again.
Mhm.
I'm just inspecting your upper and lower eyelids. So if you close your eyes for me, I'm just going to palpate lightly. Any pain in the top of your eyelids?
No.
Any pain on your lower eyelids?
No.
Okay. Do you wear glasses or contacts?
No.
Okay, so it doesn't seem like there's any issues with your eyes. Do you see an eye doctor regularly?
No. I visit one time just to check and stuff, but
One
everything
time.
was fine. Yeah.
Okay, so I'm gonna get my, I think it's in my pocket. I have a pen here. I'm gonna ask you to put your head forward, keep your head straight, and follow the pen with your eyes only, okay? So starting in the center. Very good. So he's able to follow my eyes without any difficulty. The next thing that I would like to do is test your accommodation. So to test accommodation, what I'm going to do is move the pen in towards your face and then pull it back out, and I just want you to follow it with your eyes, okay? So moving the pen in and moving it back out. Okay, so there's no issues there. The next thing that I'm going to do, normally I would use a pen light. I don't have a pen light on me, so I'm going to test pupillary reflex using a flashlight. So I'm going to look into both of your eyes with the light. You can just look straight for me. Okay. And on this side, you can look straight for me. Very good. Okay, so I'm just going to put this down. So typically we would perform a Snellen eye test. We don't have a Snellen eye chart with us, so I'm just going to explain to you. Normally there would be a chart. It has some letters on it from the alphabet. They start off very big and they get smaller. Typically I would have you stand a few feet back and cover one eye at a time and read the smallest line that you could to me. There's also a few different colors on the chart. It's usually green, blue, and red, and you ask them to decipher the different colors that are on the chart. And then that indicates whether they have a need to see an eye doctor or if they need glasses or something like that. So the next thing that I'm going to do is assess your nose. Do you have any issues with smell?
No.
No. Do you ever feel like you can't smell things, or can you decipher sweet smells from foul smells?
No, I don't have no problem.
No
with that.
problems.
No.
Okay. So normally I would like the patient to test for some kind of smell. We don't really have anything that you can smell to tell me what it smells like. So as long as you can report that you don't have any issues, then that's significant. That's sufficient.
Yeah, and I never had any issue with that.
No
so,
issues.
yeah.
Okay. So the next thing that I want to do is just assess the inside of your nose. If I can look in your nose with the flashlight, if that's okay.
Yes, ma'am.
I'm just going to grab my pen light again. Okay, so if you would just tilt your head back. I'm just looking in the nose. And there's no issues. I don't see any obstructions. There's hair distributed evenly. Nothing that sticks out as a concern. The next thing that I'm going to do is test the patency of your nares.
Mm-hmm.
So what I'm going to do is have you hold one side of your nose shut and breathe for me on the other side. Okay, and then switch to the opposite side. Okay, that's all. So the nares are patent. He has even air exchange through both sides. There's no obstructions or presence of significant mucus or like snot buildup. The next thing that I'm going to do is assess your throat area. So I'm going to grab my pen light again. I'm going to ask you to open your mouth, and I'm going to inspect your oral mucosa. If you would just stick your tongue out for me. Okay, and then back in. Mucous membranes are moist, they're pink, there's no drying or abnormalities noted. So I'm going to have you move your, stick your tongue out, move it up, move it down, and then from side to side for me. Okay, perfect. So there's no abnormalities noted. The next thing that I would do is I just want to explain how we would do a gag test. If we were to do a gag test, we're not going to perform a gag test at this time. We would put something in the back of your throat until you gag. Make sure that your gag reflexes are sufficient. Okay? So the next thing that I would like to do at this time, we are going to perform a respiratory assessment. So the first thing that I'm going to do, if you would mind just sitting up for me, I'm going to feel for fremitus.
You want me to sit up?
No, you can sit just like that. Just sit straight up for me. Feeling for fremitus. So if you would just take a deep breath in and out. And then if you could say 99.
99.
Okay. So I'm feeling that there's even vibration on each side. There's no abnormalities. One side is not more than the other. They're equal. Normal fremitus as expected. So the next thing I'm going to do is have you take some deep breaths. I'm putting my hands on the chest, and you can breathe out. Nice deep breaths in and out. And I'm assessing for symmetry, making sure that the breaths are even on each side. They're not labored. Do you have any difficulty breathing? Do you have any difficulty breathing? No. Do you have asthma, COPD, or anything like that? No. Okay. So the breaths are even. He has normal chest expansion, normal rise and fall. There's no concerns as far as breathing. The next thing that I'm going to do is percuss your chest, if that's okay. So I'm going to have you sit straight up for me. And you don't have to do anything. I'm just going to start here. Okay, so no issues in the front. If you mind just turning to the back for me. If you face your back towards me, we're going to percuss the back of his chest as well. So there's 7 areas in the back that we're going to assess. We'll start here. Okay, so we're all set with that. There's normal percussion as expected. There's no significant findings or issues. So while you have your back to me, if it's okay, I'm going to auscultate your lungs from the back first, and then we'll do the front, okay? All right. So using the diaphragm of my stethoscope, I'm going to auscultate the lungs. So the back of the lung has 9 fields that I'm going to be listening to. So I'm going to ask that you take a nice deep breath in for me. Nice deep breath out. And again, in and out. And out. And out. Okay, So there's normal air exchange, there's no wheezing or stridor noted, there's no crackling or congestion, the breath sounds are normal, they're clear throughout all lung fields. So the next thing that I'm going to do is I'm going to auscultate the same areas of your lungs, but I'm going to ask that you say 99 for each time that I move my stethoscope, okay?
Okay. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Perfect. No abnormal findings, everything sounds good. So I'm just gonna have you turn back and face forward. So the next thing I'm gonna do is the same thing. We don't have to do the 99 part, but I'm gonna auscultate the front of your lungs, okay? So again, using the diaphragm of my stethoscope, I'm gonna auscultate the lungs. There are 5 lung fields that I'm listening to. And again, just noting any wheezing, stridor, any irregular sounds. Nice deep breath. And out. Okay. Very good. The breaths are even. There's no abnormal sounds or concerns. So the next thing that I would do is measure your oxygen saturation using a pulse oximeter. I don't physically have a pulse oximeter, so what it does is you put it on the finger and it measures your pulse rate and your oxygen saturation level using the capillary bed of your nail. Okay, so normally anything above 92 is good, but you don't have any difficulty breathing, you don't present with any shortness of breath, so your oxygen saturation appears to be normal through observation. So the next thing that we're going to do is I'm going to do a cardiac assessment on you. Okay, so the first part of the cardiac assessment, just looking at your neck and assessing for JVD. So your neck is symmetrical, it's even, there's no bulging noted, there's no significant veins or arteries that stick out to me, so there's no presence of JVD. That looks good, no JVD is normal. So the next thing that I'm going to do is palpate your pulses. I'm going to use several different locations to palpate your pulses, so if you put your arms out for me. I'm going to start with radial pulses and work my way up. So I am assessing for pulses bilaterally, ensuring that they're even, they're normal. Okay, if you would put your arms out for me, I'm assessing brachial pulses. Again, ensuring that they're even and normal. No issues there. So the next thing I'm going to do is assess your carotid pulses. Again, I did this earlier, but we're assessing for even normal pulsation in the neck from your carotid arteries. Okay, so the next thing I'm going to do is assess your apical pulse. So if looking for mid-clavicular, okay, perfect. Normal pulses, bounding, no abnormalities in pulse palpation. So the next thing that I'm going to do is assess the pulses in your lower extremities. So if you could just extend your legs for me slightly, that's perfect. You could rest them on the floor. That's good. So I'm assessing for the pulses. Okay, no issues. The next thing I'm going to do is assess your pulse here. Okay. Do you mind if I take your sock off? I'm going to assess your pedal pulse. Okay. depending if the feet are cold. Sometimes the pedal pulse is harder to find, but the pulse is normal. And I'm just going to switch to the other side, and I want to assess the pulses on this side as well. Starting with the inner ankle. Okay, and I'm going to remove your sock, and I'm going to assess this pedal pulse as well. Okay, so pedal pulses are normal. Some, in the instance that you were not able to obtain a pedal pulse, there might be a need to use a Doppler, but in this instance, he has presence of pedal pulses. They're normal, and they're equal on both sides. So the next thing that I'm going to do is auscultate your cardiac system, if that's okay.
Mm-hmm.
So I'm just going to have you sit straight up for me. Okay, perfect. So the first area that I'm going to start with is assessing the aorta. Okay. Do you have any chest pain or history of chest pain?
No.
No. Okay, so the heart sounds are normal. No abnormal findings at this time. So the next thing that we are going to do is I'm going to auscultate your renal arteries.
Mm-hmm.
So if you don't mind, I'm just going to have you sit back slightly. And I'm going to be listening just in this region here, okay? So again, just auscultating renal arteries, ensuring that there's no abnormalities and that there's normal sounds as expected. I'm also going to be auscultating your femoral arteries while I'm in this area, okay?
Yes, ma'am.
Okay. Okay, and I'm just going to move my stethoscope lower towards your groin and assess the arteries there, okay?
Mm-hmm.
Okay, so there's no abnormal findings when auscultating renal or femoral arteries. So the last part of the cardiac assessment that I would like to do with you is I'm just going to check capillary refill in your fingernails and your toes, okay?
Mm-hmm.
So I'm just going to take a look at your fingernails, and I'm just pressing lightly. We want to make sure that the refill is less than 3 seconds, and it is, so that looks good. I can take a look at this foot here.
Mm-hmm.
Okay, I'm going to remove your sock, and again, I'm just going to be pushing lightly on your toes. You can relax your foot for me. Perfect. Capillary refill is less than 3 seconds. Your toes are cold though. That's okay.
It's freezing out.
Oh, it's cold out. Summer is gone, huh?
Yep.
Okay, so I'm going to check the capillary refill on this foot as well. Okay, perfect. Capillary refill is less than 3 seconds on all extremities. Again, normal findings. Sorry about that. Okay. So, the next thing that I would like to do is abdominal and GI assessment.
Mm-hmm.
So I'm going to have you lay down for me, actually.
On my back?
Yep, you can lay on your back. That way is, yep, that's good. Okay, perfect. Do you ever have any abdominal discomfort?
No.
Okay. So the next thing that I'm gonna do is I'm gonna auscultate your abdomen for bowel sounds.
Mhm.
Okay. Bowel sounds are normal active, no abnormal findings there. So the next thing that I'm gonna do is percuss your abdomen the same way I did your chest.
Mhm.
So you can just stay still for me. I'm gonna do 3 different areas in each quadrant. Okay, so normal percussion. I'm going to lightly palpate your abdomen. So I'm just looking for any tenderness, pain. Is there any tenderness or pain when I push there?
No.
No. So the abdomen is non-distended. It's soft. No presence of abnormal masses or findings. If I was to do deep palpation, I would do the same thing, only I would press a little deeper, using this to feel for any deeper issues if there was any concerns noted with light palpation. Okay? So the next thing that I'm going to do is have you sit up. I'm going to have you turn your back towards me. Oh, you can sit down though. I just want your back towards me. Yep, that's
Okay.
perfect. So what I'm gonna do is I'm going down to the 12th rib, and what I'm doing is I am percussing for CVA tenderness, and just making sure that there's no pain. So you're gonna go down the 12th on the spine. Okay, no pain, normal findings. I can have you sit with your back towards me. I mean, your back to the couch again. Perfect. So the next thing that I'm gonna start doing is assessing your joints.
Mhm.
So this is part of a musculoskeletal assessment.
Mhm.
Do you have any joint pain? Do you have any osteoarthritis or anything like that?
No.
No. Do you take any medications?
No.
No. Okay. Do you work out regularly? Are you active?
Yeah. So probably like 3 times, maybe 4 times a week.
Okay.
Mm.
So to begin, I'm going to have you just put out your arms for me. I'm just assessing the joints in your fingers and your wrists, making sure there's no nodules, no issues. I'm looking at your knees as well as your ankles and your toes. Again, no issues noted with joints. So the next part of the musculoskeletal assessment, going to have you stand up actually. There's a few things that I will need you to do. So as well as assessing your joints in your arms and your legs, I'm just assessing your hips.
Mm-hmm.
Do you have any issues with your hips?
No.
No? Okay. And your spine as well. So the spine is even, no protruding masses, nothing like that. So if you want, you could sit back down again for me. So I'm gonna assess your neck. Any neck pain or neck injuries in the past?
No.
No. Okay. So I'm gonna have you move your head forward and then backwards. So bend your, forward and backwards. And then turn your head from side to side. Okay, and then turn physically, face me, look at me, and then face the wall. Okay, and then you can do ear to shoulder. So if you could, perfect. Any pain in your neck when you do that?
No.
Any, you feel any pulling or any tenderness? Nothing like that. Okay, perfect. The next thing that I'm going to do is assess for strength in your neck.
Mhm.
So what I'm going to do is put my hand under your chin, and I'm going to have you push down as hard as you can. Perfect. Okay, I'm going to put my hand behind your back, and I'm going to have you push your head back as hard as you can. Perfect. So there's equal strength. There's no weakness or deficit needed. Oh. Sorry about that. So the next thing that I'm going to do is have you flex your shoulders, put your arms above your head for me.
How much wider you want me?
Yep, just like that.
Mhm.
Okay. And then back down. Okay. And you could stand up for me. I'm going to have you reach your arms out in front of you and, yep. And then I'm going to have you extend your shoulders back. Perfect. Any tension or pain when you do that?
No.
No. Okay. The next thing that I'm going to do is ask you to shrug your shoulders, and I'm going to be feeling for strength while you do that. So I'm going to press down on your shoulders, and I want you to shrug up for me. Perfect. And back down. Okay. So any pain when you do that?
No.
No. Okay. And you can sit back down for me.
Mhm.
So the next thing that we're going to do is I'm going to have you flex and extend your arms. So if you put your arms out, yep. So I'm going to have you flex them up.
What means that?
So I'm going to palms up and flex, and then extend back out. Okay. And I'm going to assess for strength. I'm going to push down on your arms, and I'm going to ask that you flex your arms for me while I'm pushing. So bring them up. Perfect. And back down. Okay. While I'm here, I'm going to ask you to grab my hands. I'm going to assess for hand grasps. You could squeeze. Nice and tight.
Mhm.
Perfect. So they're equal, they're strong. Normal strength noted in the arms. I'm going to assess your wrists. So I'm going to ask that you put your arms out again. I'm going to ask that you flex your wrists and then extend. And then I'm going to ask that you rotate them. Perfect. No pain, no issues with that. Okay. So then I'm going to ask that you put your hands up and push down on me while I push against you. Perfect. And then I'm going to ask that you pull back. Perfect. So equal strength in both hands and wrists. There's no musculoskeletal issues noted there. So I'm going to ask you to stand up for me again. I'm going to ask you to bend over. Yep, all the way. Any pain?
No.
Okay, so I'm assessing the spine. You can come back up. I'm going to ask you to extend back. Any pain?
No.
I'm noting even symmetry against the chest. Okay, I'm going to ask you to go from side to side. All the way down and all the way down. Okay, perfect. And there's no pain with that?
No.
So there's positive range of motion throughout the spine. Next thing I'm going to do is be assessing the range of motion in your hips. I'm going to ask that you kick your leg out for me. Okay, any pain?
No.
Opposite leg. All right, and then I'm going to ask that you kick your leg back. Perfect. No pain.
No.
And then the opposite leg for me. Okay. Positive range of motion in the hips and the legs. I'm going to put my hands against your leg, and I'm going to ask that you kick out. And I'm just assessing for strength. So you're going to feel me push back slightly. Perfect. And the other one? Okay, perfect. And you're going to go back down. So there's equal strength. You've never had a hip replacement. You don't have any hip issues, no hip injuries.
No.
No. Okay, perfect. So the next thing I'm going to do is have you bend your knees for me, one at a time. And have you bend up and extend back. Perfect. And then the other one. Okay, and back down. So I'm going to have you do it again. This time I'm going to be testing your strength, so you're going to feel some light resistance. Perfect. And back down. And again. And back down. Okay, so no pain when I do that?
No.
Okay, so there's equal strength in both knees. What I'm going to have you do now is sit down. I'm going to have test the range of motion in your feet, so it might be better if you just have a seat.
Mm-hmm.
Okay, so I'm going to have you flex your foot. Yep, you can put your foot out if you just pick it up for me. I'm going to have you flex it up towards you. Perfect. And then back down. Okay, and then this one, flex up towards you and then back out. And then I'm gonna have you rotate from side to side. Perfect. And the same thing with this one, side to side. Okay. And then I'm gonna have you flex and extend again, but this time you're gonna feel light pressure, so I'm testing strength. Okay, and then push against my hand. Perfect. And then this one, I'm gonna have you push against my hand. Perfect. I'm gonna have you pull back. Perfect. Any pain in your toes? Any pain in your feet? Okay. So there's equal strength in the feet. The last thing I'm gonna have you do as part of the musculoskeletal assessment is I'm gonna have you extend your feet. Gonna have you straighten your toes out for me and then curl them under. And then curl your toes. Yep. And wiggle your toes for me. Perfect. Okay. So the next part of the exam, I'm gonna conduct a neuro assessment. So the first thing that I'm gonna have you do, kind of some weird things, but I'm gonna have you clench your teeth for me. Okay. I'm gonna have you shift your jaw from side to side. Any cracking, any pain when you do that?
No.
No? Okay. So the next thing that I'm gonna have you, going to take I have a cotton ball and I have a harder object. I'm going to be assessing for dull and sharp pain to differentiate the difference between sharp and dull. Okay, so I'm going to be doing this on your face, all right?
Okay.
Okay, so I have you close your eyes. I'm just going to have you tell me if it's dull or sharp.
Sharp.
Okay. And then this?
Dull.
Okay, perfect. So sensation is intact, it's as expected. The next thing I'm going to do is use my pen light again. In this instance, we're using the flashlight. Going to be assessing corneal eye reflex. So I'm just going to have you look straight towards me. I'm going to flash the light straight into the center of the bridge of your nose. And what I'm looking for is light reflection in the center of both eyes. And it is normal as expected. So there's positive corneal reflex. The last thing I'm going to have you do is raise your brows for me up and down. I'm going to have you clench your eyes shut, nice and tight. Okay, perfect. And then the last part, I'm going to have you do a great big smile and then a frown. Good. Yep, perfect. Told you it was a little weird. Okay. And then also, I'm just going to have you open your mouth and say ah.
Ah.
Again?
Ah.
Perfect. Okay. No neurological deficits. Neurals are within normal limits. So the next thing I'm going to have you do is a little exercise. I'm going to have you get up. Well, actually, I'm sorry about that. I'm going to have you stay seated. I'm going to have you run the heel of your foot down your shin. So if you could run your heel down your shin. So the heel of one foot down the opposite shin. So if you would run the heel of your foot down your shin.
Right here?
Yep. So you're rubbing your heel.
Yeah.
Perfect. Straight down your shin. Yep, right down.
Okay.
Go ahead, right down. Yep, all the way down. Perfect. And if you would do it to the other side as well. Okay, no issues. Straight down. Okay. And I'm going to have you put out your finger. You're going to do finger to nose. Okay. And then back out. Can you do the other finger for me? Finger to nose. Perfect. And back out. We're assessing motor skills with this as well. I'm going to have you stand up now. You're going to do a little exercise. I'm going to have you walk for me right down to that edge of that carpet and then back. No issues walking, no shaking. Gait is steady. Okay. Then I'm going to have you walk the same distance, heel to toe this time. Yep. Perfect. Balance is steady. Okay, and then back down for me. All right. Okay, so then I'm going to have you walk on your toes. Yep, on your tippy toes, and then back. And I'm going to have you walk on your heels. All right, that's it for your little exercise session. So you can have a seat. The last part of the exam, well, we're getting towards the end here. I'm gonna ask you your initials.
SK?
Okay. Do you know where you are right now?
Yeah, home.
Okay. And then, do you know the date?
It's Sunday. What was that? 12, 13? I'm missing, yeah.
11.
Yeah, 11 October.
And the year?
2020.
Okay. And who's our president?
Trump.
Yes, very good. Okay, so he's alert and oriented, a little hesitation to date, but able to respond with slight reminders. He's oriented to the current president. The next thing I'm going to have you do, and it's a little difficult for me, so I apologize, but I'm going to have you start at 100 and count backwards by sevens.
Down to 0.
Not all the way to 0, but I'll have you start at 100 and just go back by sevens.
93, 80, 93, 86.
Okay.
679. 79 minus 7, 72.
Okay. All right, so I won't make you go much further, but
I'm tired too. So
it's okay. Nope, not a problem. So he's competent. He can count backwards by sevens. Just a little hesitant. Needs time to subtract. Not an issue. The next thing that I'm going to do is I actually have a piece of paper for you. I'm going to hand it to you. I ask that you read it and do what it says. Perfect. So he's able to read and follow instruction. I asked him to take the paper in the left hand, fold it, and place it on the floor, which he was able to complete the task accurately without hesitation. So can I ask you what you did for your last birthday? How did you celebrate your last birthday?
My last birthday. It's been years. My birthday is coming soon, so we went for. I think we went out for the family, all my kids, and
Great.
went for dinner.
Okay.
Yeah.
All right. You had some cake?
Yes, it is.
I'm
Yeah.
sure.
Yeah.
Okay. So the next step was to assess your long-term memory. Doesn't seem like there's any deficits. The next thing I'm going to do is I'm going to tell you 4 words. Ask that you try to remember them. So the words are cat, dog, duck, and bird. Can you repeat them?
Dog, cat, dog, cat,
duck,
duck,
and
dog.
bird. Yep, so dog, cat,
Dog, cat,
duck, and bird.
duck, and bird.
Okay, perfect.
Correct.
So I'm going to have you count backwards from 20, starting at 20 down to 0.
20, 19, 18, 17, 16, 15, 14, 13, 12, 11, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
Perfect. And then I'm going to ask you to repeat those 4 words for me again.
1, 2, 3, 4.
No. The 4 words. The 4 words that
Ah,
I
the
told
4
you.
words.
Sorry.
Duck, cat, bird, cat, dog.
So duck, bird,
Bird,
cat, and dog.
Yeah.
Perfect. So that was used to assess short-term memory. Some slight hesitation, but there's no deficits in short-term memory. So we're concluding our comprehensive health assessment. There's just one more piece that I would like to do with you. I'm going to just assess some sensory things, if that's okay. So I am going to do the same thing that I did on your face and have you identify sharp versus dull touch. I'm going to do it on your arms. So if you close your eyes for me.
Sharp, dull.
Dull. Okay, and then your legs.
Sharp, dull.
Okay, perfect. So he's able to differentiate. He has good sensory perception. Next thing I'm going to do is have you close your eyes and hold out your hand. I'm going to put an item in your hand. I'm going to ask that you try to identify it by touch only. Okay?
Pen.
Perfect. Okay, and then I'm going to have you hold out your hand, and I'm going to draw a letter on your palm using my finger. I'm going to ask you to close your eyes. I'm going to ask that you identify the letter with your eyes closed, okay?
Mhm.
So tell me what letter it is that I am drawing.
A.
Perfect, okay. No deficits in sensory perception. And that about concludes the exam. However, there's one more thing I want you to do. I'll just have you stand up. I'm gonna have you close your eyes and just stand still. Perfect. And then open your eyes and stand still. Perfect. So what I'm doing is it's called the Romberg test, and I'm just assessing that he can stand without swaying or losing his balance with his eyes open and his eyes closed. All right. So that concludes your comprehensive health assessment. You did great. You're in good shape.
Thank you.
Thank you so much for your time.
Thank you.
Take care.
Bye. Thank you.